Welcome to the show, Your Healthcare. I'm Dr. Lahav, and in this show we discuss medical-related issues and topics. Just information to make you smarter and more aware of your health. So it's fall season, winter's right around the corner. We're outside, football, soccer, hanging out with our friends, and you hear everybody coughing, sneezing here and there. How about those commuters into, let's say, the city or using the bus and subway, holding on to all those poles? Are you worried about getting sick? What about all these illnesses now that are coming around the fall and winter season? The respiratory illnesses, pneumonia, flu, and so forth. What do you know about prevention and some of the vaccinations available to you in order to reduce the risk of getting sick? Today we're going to answer those questions and even more with Dr. DeSilva from the West Haven Medical Group, Internal Medicine, to try to make you more aware of your surroundings and to try to prevent some of these fall and winter illnesses. I'm Dr. Lahav. This is Your Healthcare. Stay tuned. We'll be right back. Welcome back to Your Healthcare. I'm Dr. Lahav, and today with us we have Dr. DeSilva from the West Haven Medical Group, and we're going to discuss with you winter illnesses, some of the preventions you can understand and become more knowledgeable in order to make your health better. Why don't we go to the first, just kind of a general overview in my presentation, please. So we'll discuss respiratory infections, and there are many types of respiratory infections. The upper respiratory infections are one of the most common reasons for doctor visits, especially during this time of the year. Upper respiratory infections are the most common illness resulting in missed work or even school, from the pediatric population all the way to the geriatric population. The upper respiratory infections can happen at any time, but are most common during this time of the year, during the fall and winter months. The vast majority of the upper respiratory infections are caused by viruses and are self-limited. But how do you know? What are some of the symptoms of upper respiratory infections? Well, coughing, sneezing, nasal discharge, nasal congestion, runny nose, fever, which can also differentiate between viruses and pneumonia, scratchy or sore throat, and nasal breathing. Antibiotics are rarely needed to treat upper respiratory infections, and that is assuming they are viral in nature, and generally should be avoided because you want to decrease anything like superinfections. Unless the doctor suspects a bacterial infection, and that is when you should consider antibiotics, but that is where the subspecialty and the specialty of internal medicine and our guest today, Dr. DeSilva, can bring us up to date on when to consider a visit to the doctor. So the infections can include sinusitis into your sinuses, also ear infections, most common in the younger population or the pediatric population, throat infection or what we call pharyngitis, laryngitis as you're working your way down your windpipe, bronchiolitis, bronchitis, and also pneumonia. So there's different areas of your respiratory system that can be caused by infections, and obviously different symptoms and different reasons for treatment. The upper respiratory tract include the sinuses, the nasal passages or your nose, the pharynx, and the larynx. This is the upper respiratory portion. These structures direct the air we breathe from the outside to the trachea or your windpipe, and eventually to the lungs for respiration. An upper respiratory tract infection is an infection process of the components of the upper airway, the ones I just mentioned up above here. So I'm going to introduce next Dr. DeSilva, personal friend of mine, an outstanding internal medicine specialist. Prior to attending medical school, Dr. DeSilva completed a master's degree in biochemistry and molecular biology at Oklahoma State University. He attended medical school at St. George University School of Medicine and completed residency in internal medicine at Norwalk Hospital. He is the medical director of long-term care facilities around this area and several regions around the New Haven area, as well as assisted living facilities. He is also the medical director of Constellation Hospice Program and the compliance officer of the West Haven Medical Group. Dr. DeSilva is board certified in internal medicine, and I'd like to introduce him at this stage. Dr. DeSilva, thank you very much for being here with us.
Thank you for having me, Amit.
I
Glad
think
to be back.
It's really a pleasure having you, and I think this is actually a very important topic at this time of the year, fall and winter illnesses. Everybody's shaking their hands, commuting everywhere with public transportation, holding the bars at the subway or the buses, and people kind of coughing in their hands and shaking your hand. And you always get worried, what's going to happen? I want to stay away. How do I know this is serious or not? What do I do in order to prevent some of these illnesses?
Right, right.
So I'm sure you see a lot of patients coming in now with running noses and sometimes fevers or coughs. How do you first differentiate the patient coming in like this is serious or this is not serious, or a common cold, for instance?
Right. So like you said, Amit, as a primary care doctor, this is something that we see all the time throughout the year. But you're right. This time of the year, you see a lot more upper respiratory, well, also including some lower respiratory. This can get really bad at times. Majority of the time when I see patients, they're really, they need a little reassurance, make sure that they're okay to go back to work. And the question is always do I need antibiotics? And like
Yes.
you alluded to, most of the time it is viral. And this time of the year, also we should not forget it's the fall, and a lot of patients do develop allergy symptoms. And some of the symptoms including sneezing, runny nose, watery eyes, feeling a little foggy, just a little fatigue. All of these symptoms could just be that. So there's a lot of things that we need to consider before we really think about starting someone on antibiotics.
So you really kind of want to differentiate first, even sort of an allergic component
Absolutely.
this season versus an infectious component.
Correct.
And then you mentioned also the upper respiratory, which is the most common, and then the lower respiratory. What are some of the lower respiratory infections that you see?
So, the way it works is most of the time patients do get, suppose you have a viral infection, usual symptoms, sneezing, feeling fatigue, fever, and then eventually that may settle down into your chest, starting a cough. So it starts up on your upper respiratory and tend to settle down into your chest if it is truly viral and depends on the severity of your illness. So when you really talk about the lower respiratory tract, the cough is the most common symptom, And then when we talk about the cough, do you bring up any sputum? What color is your sputum? How bad is your cough? Are you wheezing? Are you short of breath?
So some people find that a little disgusting, to saying, well, what do you mean I cough it up and look it in my hand?
Right.
And also it's a difference between productive and non-productive cough.
Absolutely.
But that does make a difference what you're coughing up.
Oh, absolutely, absolutely. Even if you have a cough and do bring up sputum, that does not necessarily mean it is still bacterial infection. So the reason for antibiotics, what we always talk about, is to treat a bacterial infection. And the worst complication of all of this is pneumonia, bronchopneumonia. And later on the program, I'll talk a little bit about pneumonia vaccinations and that kind of stuff. But right, and then fever is so important because if it is usually infectious, whether it's viral or bacterial, people usually tend to mount a fever. However, sometimes, if you are immunocompromised, That meaning, your immune system is not as strong and you're taking some medications that suppress your immune system, and or elderly people, sometimes they tend not to mount a fever response. So as a physician, when you see a patient, we do consider multiple things to whether to initiate antibiotics or not. Generally, if you are compromised and also, I mean, this is true, people come and tell us, look, I always get pneumonia. And, so my approach is always listen to the patient, and, you have to consider the fact. And sometimes you have, when you look back in their history, hospitalizations because of that. So in situations like that, depending on the symptoms, you can consider starting someone on an antibiotic.
And maybe actually even more important in the older population, because the reserve for breathing is not as good, or even smokers, for instance, that
exactly.
It can lead actually to hospitalization, sometimes even death in those that can't really mount a response to it.
Absolutely, absolutely. So, there is a subset of patients that we know, if you have emphysema, if you have been a smoker, even if you have quit smoking in the past, and that tendency to go into bronchitis, pneumonia, a lot of the times patients know this. And once you identify that, the key thing is to really get checked out early rather than waiting to see how that works out. I had a patient, she usually hardly comes to the office, but very close patient of mine. One day she called, I asking for an antibiotic. On the phone, I can hear the labored breathing on the other side. She was so bad, I advised her to go to the emergency room, had multilobar pneumonia. And so, I mean, that's the tendency sometimes, people tend to wait it out and see. It's okay. You don't have to run to the doctor every time you get a sniffle or a cough or something like that. It's okay to wait. But however, if you are that person who has multiple other risk factors, it's best you come. Let your doctor take a listen to your lungs, look inside your throat, look inside the ears, listen to your heart, get your blood pressure checked, get your fever checked, and then take necessary precautions, whether you get an antibiotic or not. But there are other things that you can do to prevent you from getting sicker,
So you want to be obviously proactive at it, especially for those that are more prone to get infection.
Yes.
And what are some of those risk factors? Let's say the diabetic, for instance, the smoker. What are some of the things that you look for to say this could be important for you to see a doctor?
Right. So that patient population, is really very broad, but typically, suppose if you have a known history of COPD, emphysema, history of pneumonia, any kind of history of pulmonary conditions, sarcoidosis, you really should be very proactive when you get respiratory symptoms. The other set of patients, obviously, when you really look at the literature, people say patients above 65, but believe me, there are lots of people over 65 who are very healthy. Not everyone over 65, and we probably should change that criteria. But having said that, I think if you are elderly, I wouldn't say an age cutoff at this point, but truly, if you are elderly, also have multiple other medical conditions, congestive heart failure, diabetes, hypertension, and if you're taking multiple medications for any reason. So that patient population also should be very proactive, seek medical attention, don't wait till you are really sick to do that. And then there is also another set of patients who are immunocompromised, and they could be any age group, So for any medical reason, if you are taking any immunosuppressive medications or some certain biological agents,
So even those who say, let's say, go to a rheumatologist, those
Correct.
patients on prednisone,
Prednisone.
or other medications that are like for some psoriasis, lupus, things like that.
Psoriasis, lupus, rheumatoid arthritis. I mean, the list goes on and on. So if you are really immunocompromised for whatever the medical condition that you have, usually the patients know that. And so don't wait. Come on in, get yourself checked out. And pediatric population, obviously. And if you're pregnant, that's also critical. If you're pregnant, you're having symptoms. Most of the time, if you're healthy, it's not a big deal. You'll get through that. But, you're also at an increased risk, not immunologically, but just because by the fact that you are pregnant, you're carrying another baby,
And that's important to find that out early enough, because a lot of medication actually do cross the placenta. For someone who is pregnant,
Correct.
Whatever you take can actually affect your fetus.
Absolutely. So taking over-the-counter medications, you got to be careful. Make sure you talk to your OB, get their advice. Talk to your primary care. What should I take? This kind of approach.
And then just a little subset again, going back to the smokers.
Yes.
Because I think, you have that smoker's cough, and they usually say, well, it's my usual kind of cough.
Right.
When is something like that becomes more pronounced? Let's say they don't mount a fever, but it is becoming more productive, sort of chest tightness, more difficulty breathing.
Right. So usually when you have a compromised lung, whether it is related to smoking or exposure to multiple things, sometimes people develop chronic lung disease for many reasons, but smoking is the number one reason. So the most important thing is your usual breathing pattern changes. And obviously, if you're fighting an infection that's affecting your lung, you really have to work a lot harder. And most commonly, people develop wheezing. And sometimes you don't need a stethoscope to hear that wheezing, and patients know, Doc, I'm wheezing, I know it. So yes, again, don't wait, because this can progress rapidly and get into trouble. Many times by the time patients come to the emergency room, most of the time they get admitted for COPD exacerbation, plus minus pneumonia or bronchitis. This happens all the time. And this day and age, we talk about reducing hospitalizations. And so my advice to all my patients that I know who are prone to these things, I always tell them, listen, don't wait. When you get sick, just come in.
So the key point that you said there is
Yes.
really when your normal respiratory effort or something changes in your normal breathing, then that really is a signal to say that something could be wrong. You really should talk to your doctor in internal
Exactly.
medicine, and then find out what's going on, catch it nice and early.
Right, so don't wait till you have a fever. Don't wait till you cannot get up and go to the bathroom. You are so short of breath. And also, I should mention asthma. It's very common. So many times what happens is, for patients who use chronic inhalers, they reach out to their rescue inhaler a lot more, because that, patients, when you're sick. So if you're reaching out to your inhaler more than usual, that's an indication there is something going on. So that's the time, again, to seek medical attention.
That's a very good point. And we're going to take a short break, but we'll be right back to continue talking about winter illnesses, and also we'll speak about vaccination. I'm Dr. Amit Lahav here with Dr. DeSilva, and we'll be right back to Your Healthcare. Welcome back to Your Healthcare. I'm Dr. Amit Lahav, today here with Dr. DeSilva, the West Haven Medical Group, speaking about fall and winter illnesses. Dr. Silva, thank you very much once again coming here and talking about a very important topic this part of the year.
Pleasure to be here.
And I want to kind of jump forward and just talk a little bit about the workup, you know, chest x-rays and blood work. When do you consider doing some of this workup, for instance?
So majority of the patients really don't need all of that. Clinically, when you see someone, we can kind of see when you listen. So chest x-ray is, it's benign. However, you still get exposed to radiation, you know. Unless you really need a chest x-ray, we really shouldn't go for that route. When someone comes, if you are really sick enough, I think it's warranted, especially based on your physical exam. So when your doctor listens to you, they don't just take the stethoscope and, you know, kind of make you breathe. We listen for very specific sounds, how you sound. We also look at the way you breathe, how heavy you are breathing, and also when we look at the vital signs, your blood pressure, temperature, heart rate, all of these things kind of factor in. So for example, if you're sick enough and fighting a severe infection, your heart rate tends to go up because your body is working a lot harder, and your blood pressure tend to go down if you're fighting a severe infection. You know, you're talking about almost becoming septic. Now, when we listen to you, if we hear certain things, I think a chest x-ray is warranted. Obviously, if you hear very consolidated, what we call bronchial breath sounds, or, you know, severe wheezing, I think it's reasonable to get a chest x-ray. So in the chest x-ray, what we are really looking at is the biggest thing that we worry about, pneumonia. And the pneumonia can also be viral. There's a viral pneumonia that we see. But I think, you know, if you're really going that route, if you are thinking that way, I usually start, you know, my patient on an antibiotic, and then we kind of tailor that depending on the clinical course. In terms of blood work, it's not really necessary to do labs at that point unless you're really thinking, you know, massive pneumonia. At that time, we really should go take a look. If you already have multiple other medical problems, like for example, chronic kidney disease, and if you're thinking about initiating an antibiotic, a certain type, and if there's no recent blood work, I think that's a time to do it. Take a look.
Because some of the antibiotics actually go through your kidneys.
Yes. So it is important to kind of know what your kidney function is before someone starts a certain any medication for that matter. So that's kind of the workup. The most important thing, honestly, is how you progress over the next 24 to 48 hours. So when you start an antibiotic, and, you know, whatever the other medications, inhalers, sometimes prednisone, different kind of medications, it is so critical to do a quick follow-up to see how you're doing. Because if you're getting worse on that regimen, that means, you know, we need to take the next step. You may really need intravenous antibiotics and or more frequent nebulizer treatments or intravenous steroids. So that usually happens in the hospital. So, you know, I also should mention the pulse oximeter. It's commonly used. Most of the patients know what it is. It's to check your oxygen level, depending on, you know, it's a little gadget that you put on your finger, you measure the pulse ox. And if there is a drop in your oxygenation level in the blood, I mean, that's also very indicative that you are really having a bigger problem.
And that's actually very important. And what I get out of this is the fact that the history and the physical examination by the physician is the most important.
Oh yeah.
Everything else is really secondary, or really to kind of augment what you're already thinking or confirm if it's anything worse.
Exactly, exactly. So if you do diagnose a pneumonia after treatment and if you're clinically better, I get this question all the time, do I need a repeat chest x-ray to make sure it's gone? Not necessarily, unless you're thinking other things that's going on in your lung, because repeating a chest x-ray soon really doesn't show that it is completely gone. Even after you take the antibiotics, what we call the infiltrate on the chest x-ray can really lag behind. So repeating a chest x-ray just makes it, okay, so do I need more antibiotics or not? So it really depends on how you feel. Clinically, how are you doing? If you're doing better, I think that's the most important.
So you don't have to follow it up with any blood tests and chest x-rays. If you're improving, it's better. You're over it.
Correct. Yeah.
And let's also touch on flu.
Yes.
Because besides sort of the regular, viral infections, upper respiratory and pneumonia, flu season.
It's the flu season, no question.
So how do you know if it's flu versus just a regular upper respiratory cold?
Right. So flu is seasonal, and so this is the time of the year that everyone sees flu. We see quite a few during this time of the year. Most important symptoms of flu, usually muscle aches, myalgias, fatigue. Patients can have upper respiratory symptoms and fever.
How high of a fever, and where are the muscle aches you could get?
Yeah, the classic flu is when someone comes, fever of 102, 103, just chills, very achy, not feeling good, not a massive cough. If that, maybe, it's a non-productive kind of a cough, just some upper respiratory symptoms. In the right clinical setting, that's flu. No question about it. And you don't always need confirmatory testing to do that.
Are there tests you can do to find out if it is flu?
Yes, there is a rapid flu swab you can do. It gives you a quick diagnosis of the kind of influenza that you're fighting. So there's two types of influenza, influenza A and B. The problem is, if you're considering treatment for flu, you really shouldn't depend on that test, because when you do the nasal swab, it really depends on how good your specimen is. So you really have to go deep into the nasopharynx and get a real good swab. Otherwise, you get a false negative. Truly, you still have flu, and the swab test is negative. I've seen that happen in the hospital multiple times. So the patients come with the classic symptoms, and your suspicion is so high that it is flu. The swab done in the emergency room may be negative. Then we repeat the swab. It comes back positive.
And you're generally not that keen about having something shoved up your nose that high.
Patients don't like it, and I don't think I personally would like it.
I don't blame them. So you're treated. And let's say, what do you do for flu if you do think it is truly flu?
So typically, if you're really thinking flu and you're diagnosed early enough, there are medications for influenza. Tamiflu is the most commonly used one. And you take...
Over the counter?
No, prescription.
Okay.
So what that does is it reduces the duration of your symptoms and really doesn't cure it, If you're healthy, otherwise you're doing well, you really don't need it. Actually, that medication is very expensive. So sometimes if you pay out of pocket, it's a significant expense, and it's not always necessary. But if you are, again, elderly, immunocompromised, multiple other medical issues, there is a real utility in using that medication at that point.
So let's say you're not going to take that medication. What kind of other supportive types of treatment can you do for flu, since it's not going to be treated with antibiotics?
Right. So yeah, flu is a self-limiting illness. Typically get better in 4 to 5 days. So all you really need is lots of fluids, rest. You can, if you are having high fever, you can take Advil or Tylenol, that kind of medications, and you get better in time just with rest.
So really 4 or 5 days, not a week or 10 days?
Typically not. People usually get better during that time frame, maybe take a week. The issue of, I get this a lot, so when can I go to work? It's really important to understand, if you're sick and if you're having flu and if you're working in a public place, please don't go to work. Honestly, it's because it's so contagious, and you can affect other people. Someone next to you may be immunocompromised or maybe taking certain medications. So if that person gets flu because of you, and it's truly they can get into a lot of trouble. So there are a lot of complications of flu.
And flu is airborne, not just by touching.
Usually not. So the way how flu is transmitted is mostly respiratory droplets. And the actual contagiousness of, so if you have flu, Amit, and if you're sitting over there and cough or sneeze, all those respiratory droplets gets airborne. And I think, if you are closer than 3 feet, you're at a much higher risk. However, these droplets can travel even up to 6 feet away from you. And also it depends on how big the respiratory droplets are. So large respiratory droplets, strong volume, if you inhale it, you will get the flu. There's no question about it.
And if, let's say you suspect or you're around other people that you think may have it, can you do something to just say, I'm worried, I want to do something proactively? What about things like, vitamin C and different supplements, and some people think about honey and
yes,
and other things that are more homeopathic. Can you do something to try to minimize the symptoms you may get?
Yeah, that's a real good question.
That's why I asked the best.
Yes. There is no real proven data, like say, for example, vitamin C as an immune booster and how much it really helps in terms of in this situation. Is there any harm taking it? No, not at all. So, yes, go ahead and take that. I mean, that's fine. If you really get exposed to someone, there's a good chance that your body is going to try to fight that off, and you may really not get sick, but there is a good chance that you will.
So if you're going to get it, you're
going to
get
it. So if you are next to someone who has flu and coughed on your face, the chances are you will get sick.
And you're hoping your body will be able to fight it and
that's
kind of
correct.
move
Yes.
through that. So really, not even just the flu, the viral illnesses, you just have to let your body fight it. Assuming you're not immunocompromised, you want to stay hydrated. Do, like you said, like the Tylenol, the anti-inflammatory type of medication that can reduce fever, is rest.
Yes. So yeah, and that's really it. I mean, maybe I should take this opportunity to talk a little bit about when should you worry. So if you get the flu and you may have some improvement in 4 to 5 days, but if your symptoms go on more than 5-6 days, please see your doctor. And that could really mean that, one of the complications of flu, pneumonia, or any other complications may be setting in.
So that's almost like a super infection. You have one infection, then you have another that comes in.
Right, so the super infection, it's kind of like you never really got better with the flu. So that's what it means. So the most common complication of flu is pneumonia. And there are two types of pneumonia in that setting. Flu can cause pneumonia. It's a viral pneumonia, and you really don't need antibiotics in that setting. However, you are also more susceptible for bacterial infection, especially, there is streptococcal and staph. So the key point is, clinically you may get flu at the very beginning, and you may, if you're not getting better in the anticipated time of recovery, you really should be seeking medical attention. And flu also causes a lot more other complications along with, so, it can affect your central nervous system. If you get severe headaches, you can get encephalitis, encephalopathies, people start getting confused. You can get what is called aseptic meningitis. So it's the meningeal, the cover around your brain and your spinal column that gets infected, and so these patients get severe. These are rare, I must say, it's rare complication, but if it does happen, you need a lot of care.
Yeah, but those are serious problems.
These are serious problems. It can affect your heart, not a direct consequence of the actual virus. For example, if you have a history of congestive heart failure and now you get flu, your demand is much higher. So some people go into failure, so congestive heart failure because of that. If you have weak arteries and your heart is working much harder, so you are more prone to getting a heart attack or something, things of that nature. It can cause, toxic shock syndrome. It's a rare complication of that.
So again, there's pretty serious complications that can occur if you're not getting better, and
Yes.
really it's worsening over time. And I think the common threads through this is that most of these viral type of illnesses, from the flu to just the common cold, generally do get better as long as you're more of a normal individual immunologically.
Correct.
But if it's not getting better, really sort of the weak time frame, or it's worsening within that time frame, more like labored breathing, you're having more difficulty,
Yes.
shortness of breath, those are really signals that something is going wrong, and you really should seek medical attention.
Absolutely.
Otherwise, it should be self-limiting, and as long as you say, plenty of rest, hydration, stick with the kind of the over-the-counter type of medications,
Right.
you should be getting better.
Yes, that is absolutely correct.
And that's a point you're going to take home. We're going to take another short break, and we'll be right back to talk about vaccination and prevention. I'm Dr. Lahav here with Dr. DeSilva, speaking about cold and viral illnesses in the fall and winter season. Stay tuned. Welcome back to Your Healthcare. I'm Dr. Lahav here with Dr. DeSilva from the West Haven Medical Group, speaking about pneumonia, viral illnesses, the flu, things that you should know really at this time of the year and try to help prevent it. And speaking about prevention is, let's talk about vaccinations. Who should get it? What are the vaccinations out there? When you should get it?
So, if you ask me, everyone should get vaccinated. There's no question about it, unless you have a real contraindication, meaning there's a real problem if you get the vaccine. So I am going to say this. I make sure I get it myself. I make sure my children are vaccinated, my family, and so I do encourage all my patients to get the vaccine.
So what are some of the vaccines that you suggest individuals get?
There are actually a few different kinds of vaccines that's available. There is the trivalent and a quadrivalent vaccine. Basically, all what it means is, so the influenza A and then there is B. So let me just give a quick thing about how these vaccines are really made. So what they do is there are very intelligent people, experts in the area who work in the laboratory, months ahead. They look at different types of flu strains and then predict what the flu season is going to be. So based on that information, then you come up with the actual vaccine. Two different vaccinations. One is inactivated vaccine and the other one is a live attenuated vaccine. It's actually a live particle, but it's not supposed to really give you the flu.
So it's like a live virus, which is for vaccination, right, or attenuated, almost like a dead virus.
Inactivated, right. So, and then there is two different vaccines that come with two different, strengths. One is the trivalent. So the trivalent will have 2 influenza A strains and 1 influenza B. The quadrivalent vaccine has 2 influenza A strains and 2 influenza B strains. So that one is a little bit stronger and gives you a little bit more protection towards influenza B. Influenza A is the most common type. So most of the time, if you get the flu vaccine, trivalent is fine. And then there's vaccines that, you can take it intramuscularly or you can do it intranasal, meaning you inhale that vaccine.
So when do you consider using the 4-strain versus the 3-strain vaccine? Why shouldn't everybody get the 4-strain?
Yeah, I think it's a cost-benefit analysis, and it is not necessary for a usual young healthy person to really go for that, unless there is real prediction that you're going to have a stronger influenza B season. And actually, when we test, once the flu season starts, the CDC actually tracks what strains and which part of the state is getting affected and how severe that season is. Based on that, you can make some decisions, but maybe it's kind of late into the game.
So it's almost like a back to the future.
Correct.
Because the thing is, the vaccine is what we think is going to happen. Once it happens, then we can say, well, we were right or wrong. We should need to think this about the next season.
Right. So for example, last season the vaccine wasn't as effective as they predicted. Having said that, Amit, I will tell you, there is probably not enough data to support what I'm saying. However, I think, season after season, if you do get this flu vaccine, I firmly believe that there is a ongoing buildup of immune system that you will continue to fight, many strains of flu, because it's always a prediction.
So really kind of by having these vaccinations, your body sort of sees the different strains
Correct.
that can come around, and ultimately you can become more resistant
more
to
resistant to it, yes. So, that's the 2 different kinds of vaccines that's available now. Some of the elderly say, oh, I got the high dose, and there is that too. The biggest contraindication for getting a flu vaccine is the egg allergy. So most of the time, even if you do have an allergy, unless it's severe, you can get the flu vaccine. And there's also, this is recent, there is a vaccine that's available for patients who do have an actual true egg allergy.
So egg allergy, so that's really a true severe egg allergy is a contraindication for the flu vaccine.
Correct.
And just you also mentioned, the live and the essentially not live vaccine.
Yes.
How do you make a decision who should get the live versus?
So, typically if you're healthy, have no problems, it's okay to get the live attenuated vaccine. In my office, we always use the inactivated vaccine. I feel it's a little bit more safer based on personal experience. But yeah, usually you should not get the live attenuated vaccine if you're pregnant, if you're immunocompromised, if you are truly elderly and has multiple medical problems. You really should not get the live vaccine.
And what about the pneumonia vaccine?
So that's the whole separate topic. You can get the pneumonia vaccine throughout the whole year. And there are two different vaccines for pneumonia now that is available. There is the pneumococcal 23 that has been available for years. And just recently, they released the new vaccine. It's called Prevnar 13. There's a lot of commercials on TV. I'm sure most of you have seen it. So both vaccines are recommended to prevent pneumonia. And
for which population?
Yeah, right. So
because that is different than the flu.
That is different than the flu. So, but I want to mention this real quick before I talk about the pneumonia vaccination. So if you're contemplating whether to get the flu shot or not, think about others.
Good point.
Yes, because I'll tell you, suppose if you get the flu shot, and there's a possibility that you may prevent getting flu for you, it's also a public service, I think.
I fully agree with that.
No, yeah, especially if you are working in a healthcare environment or nursing homes and that kind of stuff. It's so critical that you get that vaccine unless there's a real problem with it.
Because in close quarters, it can spread pretty
Correct,
quickly.
yes. If you get the flu, there's a good chance you will infect at least few other people around you. And one other contraindication for the flu vaccine is this medical condition. It's called Guillain-Barré. If you have gotten it in the past, so we hesitate, especially if you've gotten Guillain-Barré after getting the flu vaccine within 6 weeks or so. That's a real good indication that may be what the issue is. So,
and just to let our viewers know, Guillain-Barré.
Guillain-Barré is a condition where it affects your muscles, your strength. It's a neurological disorder. It's very serious. Kind of almost paralyzes you. If not treated well, it can cause death.
So it's not subtle. It's something you would know.
Oh yes, it's yes. Essentially, you become so weak, affects most of your muscles, kind of goes all the way up, including your diaphragm. So you might not be able to breathe well, and it's a very serious condition.
And just to finish up with the pneumococcal vaccine, what are the population that you would suggest?
So yes, so talking about the pneumococcal 23 is indicated. The guidelines just changed for anyone, so all the pediatric population gets it. And if you have diabetes at any age group, you're supposed to get the pneumococcal vaccine. And at age 65, usually is when people got the pneumococcal vaccine up until recently. So since the new guidelines have come up, the second form of pneumococcal vaccine, it's the Prevnar 13, it's the new one. Now it is recommended getting the Prevnar 13 at age 65 as the first line of vaccine, and then get the pneumococcal vaccine a year later. So there is a lot of patients who've already gotten the pneumococcal vaccine at some point. So if it's been over a year, they should get the Prevnar 13 as well.
So it's really for the pneumococcal, it's a pediatric population and then the older population.
Correct.
As opposed to the flu, which
across the board.
Everybody should be getting it.
Exactly.
And then just in the last couple of minutes that we have before closure here is some maybe quick preventative type of things, using things like alcohol-based solutions for the hands if you're around, around close quarters. What would you recommend?
So the most important thing about prevention, honestly, it's respiratory. If you're coughing, sneezing, take universal precautions. Cover your cough, turn around. After that, you can use Purell. That's good. Hand washing. Typical hygiene techniques that your mom taught you growing up. Don't forget that. And especially if be courteous, I would say. If you're going somewhere and you're sick, I have patients who wear a little face mask. It's okay to do that. And if you're sick, you're going to the doctor and you're really sick, many of the doctor's offices actually put them in right there in the waiting room. But if not, you can get one and then make sure you travel with that. It is not uncommon for us to see that people walking around with a little face mask just because that means you're doing the right thing. It's okay to do that.
And that's very important. It's about doing the right thing.
Absolutely.
And learning the right thing to make your health better. We're going to take a short break and we'll come right back and recap today's show about fall and winter illnesses. Stay tuned.
Time flew.
Welcome back to Your Healthcare. I'm Dr. Lahav here once again with Dr. DeSilva from Internal Medicine, West Haven Medical Group. And just in the last few minutes that we have, Dr. Silva, some last remarks on, I think, pneumonia.
Yeah, it is important to understand because it's such a, they used to call pneumonia old man's friend because, most of the time if you get pneumonia, people didn't used to make it. So pneumococcal vaccine is such an important vaccine that if you are due to get it, please don't hesitate to get that vaccine. The vaccination has prevented significant pneumonia just based on that. Most common form of pneumonia comes from streptococcal pneumonia, and that actually is the reason why we are so aggressive treating everyone with this vaccine. Just because of doing that, we have reduced the number of streptococcal pneumonia over the years. But still it continues to be the most common form of pneumonia. So having said that, if you get the flu, if you're not getting better, think that it may be getting pneumonia, so reach out for your doctor. And if you are elderly, getting sick, having fever, trouble breathing, coughing, make sure you see a doctor. because pneumonia can kill.
And that's actually a very good segment here from Dr. DeSilva. And again, I want to appreciate the time with Dr. DeSilva here today, really covering a very important topic at this part of the year regarding viral and pneumonia type of symptoms. And really what you learned as a kid from your mother, wash your hands, wash your hands. That is extremely important. Even some of the alcohol-based formulations that you can use, really the mechanics of washing your hands is better than just putting something on your hands. Also covering your cough, or if you know you are sick, really preventing the spread of these illnesses, be viral or even pneumonia or more significant type of infections. Just think about those around you, and that will help prevent others from getting it. Otherwise, you depend on your body. The healthier you are, the better your chances are getting over it very quickly. But you have to be aware of kind of what's going around, getting the right vaccines, and of course, any questions, address it with your primary care physician. I mean, you need to be better about yourself and really being more proactive about it. And just like Dr. DeSilva here, he's there to help you out and make you better. Happy Halloween, happy trick-or-treating. Just watch out how much candy you eat. I'm Dr. Lahav, and thank you for watching Your Healthcare. We'll see you on the next show.